smiling face, I have to smile myself.
Good morning and welcome to Your Dental Health. I'm Dr. Margaret Ames. I'm a general dentist and I'm practicing minimally invasive dentistry. You can reach me in my office at 631-261-4525. That's 631-261-4525. Thanks for tuning in today. Long Island News Radio received an announcement from me about this new paradigm shift in dentistry. And they said, you know what, we're not going to do a story about that. You need to get that word out to people. So that's why I'm here today. The mission of the show is to inform you of this paradigm shift in dentistry. There's no more Civil War dentistry. We think of the Civil War, somebody had an infection, they'd have to cut the leg off. That's amputational. We don't have to do that anymore in dentistry. We don't have to cut away the healthy parts of the tooth just to put a crown in. I have a quote here from the Journal of the Arizona Dental Association from October 2009. No tooth deserves a crown. The age of adhesive rebuilding is here and now. The science is clear and succinct. Adhesive treatment is analytically based and predictable. That's pretty exciting news. Unfortunately, you can't go backwards. If you have a crown, you can't undo that. You can't unring the bell. What you can do is save all your other teeth from needing to go down that path of amputational dentistry. I also want for you to experience more comfortable and less invasive dentistry. So after my last show, I got a number of questions on my website. That's Dr. Ames at drames.com, drames at drames.com, asking me, a number of them were about crowns. What is a crown? A crown is a cap. That's a lay term for it. People say, I have to have my teeth capped. I'm going to have all my teeth capped. Well, capping your teeth is really amputational. And the only teeth that recent science has proven, the only teeth that need a cap or a crown are those that already have one when their crown fails. Actually, the insurance industry, if you're lucky enough to have dental insurance, they will pay part of your crown fee. And they'll do that if your crown fails within 5 years, they will pay the insurance part of it again 5 years later. Now, I tell my patients, if my crowns failed in 5 years, I would retire. I would go find something else to do. But even the best crowns, which last many years, lead down a slippery slope to 20th century dentistry, which is oftentimes a root canal, oftentimes breakage, decay around the crown. Eventually, with a root canal, you can have surgery to restore a failing root canal. All of this is pretty sad. I have a friend who's a dentist, actually. I have lots of friends who are dentists. But there's one in particular, had to have her tooth extracted. She's in her 50s. She did everything right. So she went to the periodontist and she saw she had pain in her tooth and she wanted to save the tooth. And the periodontist said, we can't save your tooth, Barbara. It just isn't going to work because there's a crack down your tooth. And she said, how could that happen? I did everything right. And he said, well, it has a root canal and a post. That's what happens. Then she went to the oral surgeon to have the tooth out. And she said, how can this happen? I mean, I did everything right to save my tooth. And he said, you know what? It's a root canal tooth. It has a post. What do you expect? You can have an implant. But it really broke her heart, and it made her think twice about how aggressive 20th century dentistry is. So back in the day, all that we were taught, and are still being taught in dental schools, is to take away the old filling, take away any weak cusps, and then take away the healthy part of the tooth so that you could fit something like a thimble over your finger. Thimble is used by tailors to push the needle through, and it fits like a cap over the tip of your finger. That's the whole outside of the tooth has to be amputated in order to fit a new crown made by the lab over your tooth. That crown has a space underneath it between the crown and the tooth. It's microscopic, but there's a space that germs can fit in. So even the best made crown in the world, when the germs can fit in underneath there, you wonder why crowns work at all, because the cement leaches out over time and the germs set up a little community in there. And eventually you're going to have sensitivity, or the dentist is going to find decay underneath your crown, and you're going to have it redone. 80% of dentistry is redoing old dentistry. How sad is that? So if you think of the way a cap is adhered to your tooth, I think of if you're washing the dishes, by hand before we had dishwashers, you'd stack the glasses. They'd be a little bit wet, and you can't pull them apart. It's really kind of hard. By the way, you're listening to Your Dental Health with Dr. Margaret Ames. I'm practicing in Western Suffolk County. My phone number is 631-261-4525. At 631-261-4525. My website is www.drames.com. So back to where we were. The microgap, the best crown in the world, done by the best dental faculty member of a dental school under ideal conditions, still has a space underneath. So we used to think that we had to do what we call mechanical retention. That's like those two glasses that have a little moisture in them. That's how they're held together, mechanically. A screw is held in mechanically. Whereas with advanced adhesion and biomimetic dentistry, you apply the restoration, or I apply the restoration to the tooth. Even if the tooth is flat, I save all the parts of the tooth structure down by the gum line. So by doing that, I use something like Gorilla Glue for the mouth. And when I first started to do this, I had a patient that she's been with me for many years, but her front teeth were really worn. They were shortened. In my heart, I just couldn't cut down those teeth and put crowns on them. She didn't care how they looked. They were acceptable. But she had worn through the enamel into the dentin. And the dentin is 7 times softer than the enamel. So I said, Betsy, we need to do something about this. I don't want to be too aggressive with it. But I'm finding that adhesion is remarkably stronger than what they had thought. So how about we do this? I will just bond the proper length. I'll match the color. It will be aesthetically beautiful. You'll love it. But most importantly, it will protect the dentin, and you won't be able to wear it anymore. In our sleep, we go through movements so that we find the parts of the teeth that are uneven. When teeth clash, when they crash into each other, in our sleep, we want to remove the thing that's causing. It's like when you have a hangnail. You just pick at it all day until you finally get it off. And humans developed this quality or this trait because when we're little and we have baby teeth, we go through growth spurts. The baby teeth are actually softer than adult teeth. So when we go to sleep as a baby, maybe your bottom jaw is going to grow a little bit more than your top jaw. So the next day, your teeth don't fit together right. So you'll see kids that grind their teeth. The parents will hear them in their bedroom, and you'll see flat teeth. This is a good thing because the child can then make all their teeth fit together. Fortunately, or unfortunately, we retain this trait as adults. So that's the cause of grinding. The gears don't fit together right. The teeth collide. So in our sleep, we try to make them fit all evenly. That's one of the reasons we break teeth. Another reason that we break teeth is because of the use of silver-mercury amalgam. Mercury and silver expand at a different rate than your tooth structure. So when you have, the environment of your mouth is hot and cold, it's salty, it's acidic. So as the amalgam expands and the tooth expands, there's a little space where the bacteria can percolate in underneath the crown or underneath the silver filling. Also, over time, the silver filling expands and causes the cracks in teeth. So when it's time to replace the silver filling, the dentist says, you're going to need a crown on that tooth. When actually, current science has proven that with modern adhesion, Gorilla Glue of the mouth, you do not need to destroy all those healthy parts of the tooth. This is so exciting. I'm at a time in my career when, a lot of my friends are kind of getting burnt out and they just say, I'm doing the same thing over and over again. This is so exciting. I'm so excited. I had a patient in the other day and I started to restore his tooth. I did the restoration about 8 years ago, really big. And I wrote in his chart, he needs a crown. This time I said, I'm glad we didn't get to do that crown because I can actually restore your tooth biomimetically to mimic life. I can rebuild it. So I turned around, I looked at the x-ray and I said, oh my gosh, I can't believe I did that. I mean, that tooth looks like it's all filling. And I was able to save all the healthy parts. So down by the gum line, I think of the part of the tooth at the gum line is like your waist, where if you bend over at the waist, well, your tooth also bends. It has flexible components to it. If you put a rigid structure a crown, porcelain fused to metal, or all porcelain or all metal, if you put that onto the tooth and the tooth wants to bend, then you're going to have a problem because the crown will win, the tooth will break. You'll have a biological catastrophic failure. So stay tuned. We're going to take a brief break. You can reach me in my office at 631-261-4525. At 631-261-4525. I'm Dr. Margaret Ames. We'll see you after the break. Thank you for tuning in.
And when you give me that pretty little pout, it turns me inside out. There's something about you, baby, I don't know. Isn't it amazing a man like me can feel this way? Tell me how much longer it grows.